Hi, my name is Heather Palmer, and I work at Maximum Capacity Inc., and I am a member of the Scientific Advisory Panel for the GenWell Project.
Can you tell us about yourself and the work that you do as the National Director, Cognitive Wellbeing, and the founder and director of Cognitive Rehabilitation for Maximum Capacity Inc.?
Sure. My background is neuropsychology, which is the study of brain-behavior relationships. And with that as the foundation, I work as a clinician, scientist, and an innovator in the area of neurocognitive rehabilitation. So more simply put, all that is to say that I build cognitive programs that are designed to help people to maximize how they think, how they feel, and how they function.
And you have an incredible passion for the work you do with seniors. Can you tell us about where this comes from?
Absolutely. I've loved working with seniors, or as I prefer to say, elders, since I was 3 years old. And in fact, my earliest memory is visiting my grandfather in a nursing home, and my parents couldn't find me because I was running from room to room visiting all of the residents. And I think that even at that young age, I really instinctively understood how incredible they were and the wealth of knowledge and experience that they had. But I also understood how much they enjoyed the interactions with me, and that made me feel great. So making them happy made me feel happy, and that was a level of a connection that I continue to crave today.
And we know the pandemic had a catastrophic impact on the lives of many elders and their families. But do you think the increased societal level of awareness about the devastating impact on loneliness is having a positive impact on the care and concern in the lives of elders?
It's a tricky question for sure, because the pandemic has absolutely raised awareness of the impact of social isolation and loneliness, and more importantly, everything that individuals can do to help themselves and each other. And so as a result, I do think that we have made great progress, but nowhere near where we need to be. But specifically in terms of our elders, I think some important understandings are missing. And as a result of that, support on a societal level is lacking for them. So, for example, as we age, our brain changes. And with those changes, there are aspects of our thinking that change as well. So in particular, we see changes in the front area of our brain or the frontal lobes, and that's the area of our brain that helps us with organizing, planning, decision making, taking the initiative. So while elders really do enjoy social engagement and even understand the value of it to their well-being, the ability to take the initiative, to make the plans, to organize the activity, make decisions can be much more complicated or overwhelming for them. So I think what really needs to happen is we need to recognize that so that we're providing that level of support so those kinds of interactions can happen.
And if there was an elder watching this interview or someone who has an aging elder in their family or a neighbor living next door, what would be your tips to help them build healthier connection habits?
Well, I'd ask them to think much more deeply about the impact that natural and normal changes to the brain might be having on their ability to coordinate the social activity and actually get out there. So similar to what I just said, but I also think it's also important to recognize that computer-based interactions might be more overwhelming or more complex for them. So as a family member or a friend, I would suggest just step in and help to take that initiative and take some of the responsibility of the organizing off them. And if you're an elder yourself, then don't feel shy about asking somebody to help with some of the aspects of the social connection that you might find overwhelming. We need to rely more heavily on those who are younger and whose brains find it super easy to do these things to help compensate for when the brain is changing.
And as a member of the GenWell Project Scientific Advisory Panel, we'd love to know what you do to stay socially connected in your life.
Well, first, I feel very socially connected. And so I started to think about this a little bit more, and I narrowed it down to four key factors, I think. So first factor is my friend group. So I have a longstanding, easy access, large social group that goes way back to when I was a baby. And over the years, elementary school, high school, university work, just acquired more and more people. So it makes it very easy to socially engage. I also have multiple social communities, so I feel very strongly connected to different communities like my rowing community, my pickleball community, my social friend group. I live in a condo. There's a very strong condo community here. So there's lots of opportunities, and I take those opportunities. Number three is awareness. I recognize the importance of human connection, and I'm very purposeful and conscious about what I do. In fact, you might think it's crazy. I even count, sometimes on a daily, at least on a weekly basis, how many social interactions did I have this week, and am I meeting my standard for myself? And it's not too hard for me. Like I go to happy hour on Fridays and play cribbage on Tuesdays and euchre on Thursdays. So my environment is set up to really make that social connection easy. And then last but not least, I actually do love meeting people. So I'll talk to anybody, strangers. I find everybody to be fascinating. So it makes it easy just to connect with people throughout my day as I come across them in the grocery store or anywhere else.